Good afternoon. The purpose of the meeting this afternoon is to review the employee benefits program that you have available as an employee of Village Vets. Good afternoon. My name is Karen Klopp, and I'm with Arista Consulting Group. We are the consultant and the broker that works with Village Vets to design, manage, and administer your employee benefits program that is offered through your employer. Our meeting this afternoon is to review your benefit offerings and explain the open enrollment process and hopefully provide you with all of the information that you will need in order to make an informed decision about how you would like to manage and enroll in the benefits program for yourself and any eligible dependents that you wish to provide coverage for. Our open enrollment period will begin this coming Monday, August the 8th, and it will run for 1 week through the following Monday, August the 15th. During that time, you will have an opportunity to review all your options and make changes throughout the week should you make your elections earlier in the week and then change your mind or wish to make any changes. So the system will be open for an entire week, and it is flexible, and it will allow you to make those updates as needed. I'd like to begin by stating that all of your benefits through the Village Vets Benefits Program are available as of September the 1st. That means that any updates or changes that you make during this coming open enrollment period will be reflected and will be effective as of September the 1st. During this time, you will again have an opportunity to review all of your benefits. As an employee and an eligible employee, you have the opportunity to enroll in coverage for the medical plan, the dental plan, and a vision plan. I will review all of these options during the course of this recording. And if you have any questions or have any specific information that you need, once reviewing all of the information, I will provide you with resources that will allow you to receive that additional information. All regular full-time employees who work a minimum of 30 hours per week are eligible to participate in the benefits program through Village Vets. You may provide coverage for not only yourself, but also your dependent spouse and dependent children up until the age of 26. Children up to the age of 19 are available for enrollment on both the dental and the vision plans. During this time, you can review those benefit offerings, and you may choose to either add, delete, or modify the current elections that you currently have. The open enrollment period is the only time of year of which you will have the opportunity to make changes to your benefit elections. Outside of the open enrollment period, which again is August 8th through the 15th, you will not be able to make any changes to any of your elections unless you were to experience a qualifying change in status. And a qualifying change in status is defined as a life change, and that could be a marriage, a birth of a baby, a loss of coverage for either a spouse or a child, some type of life event that will allow that change to take place. Our open enrollment benefits are managed through an online enrollment system called Employee Navigator. And at the end of your benefits booklet, which I will provide you with information as to where you can obtain a copy, you will find instructions on how to enroll through the Employee Navigator system. All benefit eligible employees will automatically receive a link to the Employee Navigator site that will be sent to your email address that you have on file with Village Vets. That will be sent to you on Monday. And at that time, we ask that you click on that link, set up your login and password information if you have not accessed the system before, and complete the elections. The system is very user-friendly. It will walk you through each page of the enrollment system, with each page describing the benefits, the costs of those benefits, and then finally, it will allow you to finalize those benefits with a review of what those costs from a per paycheck basis will be. I mentioned the qualifying status changes. Again, it's open enrollment is the only time of year where you can make changes freely without experiencing a life event. Otherwise, you will need to have one of those changes I described before, a legal marital status change, or the loss of coverage, or your birth or an adoption of a child, perhaps. So please be mindful when you do enroll in your benefits and you choose those elections, because you will not be able to make those changes unless one of those situations does occur. You will have 30 days from one of those change in status situations to make updates. So please be mindful of that 30-day time frame. Please work with your human resources or your benefits representative at Village Vets to make any changes that you may need to those current elections, should you experience a qualifying status change. I'd like to now turn my attention to a brief description of the benefit plan offerings that you have available through Village Vets. We partner with Humana. Humana is your life insurance, is your medical plan provider. It is also your provider for your dental and your vision plan benefits. The medical plan does provide the opportunity for you to choose from 3 different plans. Nice, robust offering where you have a difference that is based on whether you wish to have a higher deductible with some co-payments, or if you would like to have a smaller deductible with less out-of-pocket costs. So starting with our first plan, it is a point of service plan. It has a $3,000 deductible. You also have a 20% coinsurance, which means that once that deductible has been satisfied, you're responsible for 20% of your healthcare related expenses. Now, this plan does have first dollar benefits. And what that means is that you can go to a primary care doctor. You can have access to an emergency room should the situation be needed, or an urgent care facility, or a specialist provider. You can access those services without satisfaction of the deductible. A primary care visit, $35, a specialist, $60, and then an urgent care visit at $100. You also have co-payments available for your prescription drugs. All the prescription drug co-payments for all 3 of the plans are the same. Generics can be obtained for a $10 copay, and this ranges then up to a coinsurance amount if you have to use a higher cost medication. But again, you can receive all of your prescription drug benefits based on a copay, and the deductible is only applicable for such items as lab and x-ray, perhaps an MRI, and then both inpatient and outpatient services. There is an HMO. The HMO does not have a deductible, but does also have co-payments for your office visits and co-payments for the pharmacy. And then finally, you have a point of service plan that has a $1,500 deductible. And that plan does not have a co-insurance. However, it will also have those co-payments. So all 3 plans, my best suggestion would be to review the plan offerings and review the costs of the per paycheck costs for each one of the plans, and then determine which one of those plans would best meet the needs of yourself and for your family. Some employees like to have a smaller out-of-pocket cost when they seek services, and they wish to have a higher cost from a per paycheck standpoint. Others like to have a lower per paycheck cost, and knowing that they probably don't utilize the health plan or don't have any significant medical conditions, they are okay with having a higher deductible so that that out-of-pocket or out-of-paycheck cost is a little bit lower on the front end. But all of the plan design information is included in the benefits guide, and I would encourage you to take a look at that, compare the plan designs, compare the costs of the plans, and see which one will work best for yourself and for your family. I think it's very important. I like to spend a few minutes talking about preventive care. All three of the plans that you have the opportunity to choose from through Humana provide wellness benefits or preventive care at 100%, which means that you and any dependents that you cover can go and have your regular wellness exam with your primary care doctor without any cost. So you can have your child, you can take your child to have their well child visit. You can have your annual physical and any of the age appropriate related services and testings and health screenings that are based on your age and your gender and even your personal health history. All of those tests determined by your doctor and the plan should be covered at 100%. You may also have additional screenings that you wish to have or are completed during the course of that visit. And as long as they are age appropriate and are determined to be in the best interests of you and your doctor, they should be covered at 100%. As an example, a mammogram at the age of 40 is going to be covered by the plan at 100%. You do need to be mindful that there are times that during the course of a wellness visit, there are services that may be performed or received that are not considered to be preventive. And I'd like to point that out is that there are times where conversations will take place or services are performed that are not considered to be preventative care. If that does occur, then those services would be subject to the same plan design and cost structure, whether that's a copay or a service that is subject to the deductible. That would be your responsibility. If there are any questions that you have about billings or whether or not your services performed during the course of the visit would be covered, then I would like to recommend that you speak directly with the provider, Humana, and there is a toll-free number on the back of your ID card. And I also have a list in the benefits guide with all of the contact information for each one of our providers. Now, one thing I'd like to talk about very briefly during the course of the information session is just to provide some guidance as to where you are able to seek help or to go to receive the best care. There are several options that you have available to you through your health plan, and I'd just like to outline those very quickly for you. You do have access to telehealth or telemedicine. This allows you to go to either the website or to the app on your phone and reach out to the telehealth medicine provider and seek care. I like to recommend this for minor ailments or situations where you may know what your condition is and you may just need a prescription. You may wake up in the morning and have a sinus infection and know that you just need to get some antibiotics and you will feel better. The telehealth medicine would be a perfect example of when to use it for that particular situation. You may have eye pain or ear pain, or your eyes are irritated in the morning and perhaps you've got an infection. The provider through the telehealth program would be able to diagnose that situation and even forward your prescription directly to the pharmacy that would be available for you to pick up at your convenience. The telehealth services are available 24/7, and you do speak with a board certified doctor. You don't need to make an appointment. you just need to contact the telehealth provider directly and set up a profile with all of your information, health history, so that they have all of that when it is your turn to receive your treatment. You do have access to retail health clinics. These are freestanding urgent care clinics that are commonly located throughout our communities. You see them in parking lots, you see them in strip malls. They're fairly conveniently located throughout town, and they provide extra hours, extended hours for services, typically staffed by not only physicians, but also by nurse practitioners. You also may sometimes see them at a pharmacy, such as a CVS or a Walgreens. These retail clinics are great when your situation when you need to see medical treatment outside of hours that your primary care doctor or your regular doctor would be available. So you may have a situation where you are ill, maybe you've got the flu, maybe you've had a minor accident, maybe your child has a fever or some sinus issues. These are great situations that lend itself to a retail urgent care clinic for services. Again, because they're available extended hours, usually earlier in the morning, usually later in the afternoons or into the evenings when your primary care doctor may not be available, or you simply may not be able to make an appointment with your primary care doctor at the last minute, and you do feel you need to seek urgent medical treatment. This is a great option for you. So please remember that those urgent care centers are convenient and are available to you. Of course, you have your primary care doctor that is available to you. Your primary care doctor is the one who manages your care. That doctor is going to be somebody who gets to know you, who you see on a regular basis, and can provide guidance who can provide guidance for additional services and additional treatments or additional even recommendations to doctors that you may see, may need to see for your condition. Your primary care doctor is just an overall doctor and is not a specialist, and he may feel that you may benefit from seeing a cardiologist, for example, or he may want to send you to an allergist for an allergy situation that he or she may not be able to treat. So I'd like to encourage you to have a primary doctor, somebody that you can access on a regular basis who will manage your care for you. Your urgent care centers. So in addition to the retail health clinics that I mentioned earlier that are available in your, like at a major typically in a major pharmacy such as a CVS, you've got a freestanding urgent care center. Also very similar to the freestanding, the retail health clinics, but these also don't require appointments. They are conveniently located throughout our communities and are staffed with not only nurse practitioners, but they also will have physicians on staff. They can treat things that are a little bit more serious in nature. They can treat injuries. They typically could do stitches. They typically will have x-rays. They can do testing such as for a sore throat, if you feel like you may have strep throat, they can do testing on site and provide you with the results immediately. And then lastly, your emergency room. The emergency room should only be used for life-threatening situations. Perhaps you're experiencing chest pain and it's the middle of the night, or you've had an accident and there is a broken bone, or you feel that your situation can simply not wait to be attended to until you can get into either an urgent care center, or perhaps the urgent care centers aren't even open at that time. So your urgent emergency rooms, really life-threatening conditions, All doctors are trained in emergency medicine and therefore can treat some more serious situations. And those are available 24 hours a day, 7 days a week at your local hospital or closest hospital location near to you. Your dental plan, just switching gears here a little bit. Your dental plan is also provided to you through Humana. We'd like to encourage everybody have a dental plan and have your annual exam, your annual cleaning at least once every 6 months. The plan provides preventative care benefits, this cleaning, your exam, at 100% as long as you use an in-network provider. And we encourage you to go to humana.com to find a dentist that is in the network so that your out-of-pocket costs are the least. Your annual deductible, should you need additional services, such as either restorative services such as fillings or crowns and oral surgeries. There's also major services that the plan will cover at 50%. Crowns, bridges, dentures, periodontic and endodontic care is covered at 50%. I apologize. The restorative services such as your fillings and crowns are covered at 20%, and that is your responsibility. The plan has an annual maximum benefit amount of $1,000. And then finally, Village Vets offers a vision plan. Your vision plan is also available through Humana. Recommend that you go to humana.com if you need to make an appointment for a vision exam and locate an in-network provider. Your in-network provider will result in less out-of-pocket costs for you at the time that you receive services so that you're not having to pay greater out-of-pocket costs by not using an affiliated provider that has contracted already with Humana. You do not need a vision ID card at the time that you receive your services. Your provider can verify your coverage directly through Humana. In addition to providing your basic vision benefits, such as a routine eye exam and your frames and lenses, you can also receive contact lenses. If you don't want glasses, you can have contact lenses. All of the benefits are available every 12 months. So you can get an eye exam every 12 months, and you can have lenses every 12 months. The frame coverage is once every 24 months. There are also additional savings and discounts that are available through the vision plan. You can receive discounts for glasses, additional pairs of glasses if you like, sunglasses. There's also a benefit for vision correction should you wish to utilize laser services. So lots of great benefits available through the vision plan. I mentioned early in the presentation that the enrollment process for Village Vets for open enrollment and also for all new benefit eligible employees is conducted through our Employee Navigator online enrollment system. All employees will receive an email at the beginning of open enrollment or at the time that they receive their eligibility information for enrollment if they are a newly benefit eligible employee. The Employee Navigator website, there'll be a link. You will click to log on. If you have not registered or have not been in the system before, you will just need to create your own account with a username and password to provide you with access to the system. You will have a number of tasks that are requested, and that could include just the providing of some basic information that your employer has requested. Once you have completed that little onboarding process, you will be directed to start your enrollments. You will have all of the benefit information that we have just discussed, the medical plan, the dental plan, and the vision plan listed out per page. You will make your elections. You will also see that you have all of the cost information for each one of the plans included. And that includes the cost for not only yourself, but the cost if you wish to provide coverage for any other member of your family that is eligible to participate with you as a dependent. It's important that you click and save at the bottom of each screen so that you save all your elections. You will be asked to provide perhaps beneficiary information, or you may be asked to provide physician care information. And if so, that is dependent upon the plan information, and you will be prompted to provide that information should that be applicable to you. And then please just remember to confirm your elections and just review that all of the information that you have elected is correct. Again, if you wish to make changes during the course of the week of open enrollment, the system is open and available for you to do that. However, after the open enrollment window has closed, you will no longer be able to make any changes. So just be mindful that the elections that you make will remain in place for that next 12-month period. I would like to guide you also to a copy of the Employee Benefits Guide. It does have a high-level overview of all of the information that I've just described, and you may find it helpful for reference purposes if you have a situation where you require medical attention and you're wondering how much it's going to cost you to go and pick up a prescription, or how long it will take for your information to be updated. All of that information should be contained in the benefits guide. And the benefits guide will be posted on the Employee Navigator site so that you will have access to review it. I mentioned that we have support services and can help you should you need assistance or if you have questions. You can call our Employee Benefits Assistance line at 866-370-3119, or you can send an email to help@aristacg.com, ARISTACG.com. We have representatives available who can assist you with answering any questions. Perhaps you need an ID card. Perhaps you have received a bill from a provider and you're just not sure whether or not it should be paid. They can help explain that to you. We do have member services available both through Humana for all of the plans that I have described, your medical, dental, and vision plans. And that contact information is also included in the guide itself. Towards the back. So if you have questions that may be better answered, or you would feel more comfortable speaking with a representative of the insurance company, then we do have the contact information listed on the guide as well, or you can locate that number, which is conveniently located on the back of your ID card. I'd like to thank you for your attention this afternoon. And again, if you have any questions, please feel free to reach out to our Employee Benefits Assistance line, or you may direct them to your benefits human resources representative, who will also be able to assist you with any questions or services that you may need as it relates to your benefits program or to the open enrollment process itself. Thank you and have a nice afternoon.